Hi, how are
Huh?
you?
Hi, I'm great. How are you?
I'm good. I'm going to turn up my volume. It seems a little low, and then I'm going to adjust my camera a little bit so my forehead's not totally cut off. Hi,
Okay.
guys. Okay, cool. So I'm so excited. Thank you so much for coming on.
My
Um,
pleasure.
this is going to be really cool. So I had a few people already ask me some questions in the comments, but
Great.
let's let a few more people join on. You guys tell me where you're coming from and where you're joining from. Let me wave to a few people. You guys, like, you just don't even know, like, how lucky we are right now to have Dr. S. Carter on with us because he is a genius. So just to give a little bit of background, I had the pleasure of connecting and meeting can I call you Dr. Ross?
That's fine.
I know it's Dr. Carter, but I just like calling you Dr. Ross.
Dr.
Okay.
Ross is fine.
Dr. Ross and his beautiful wife last fall, and they're just incredible, magical people. And I actually got to do a treatment with them. So we'll kind of dive into that a little bit later. Like once we get a chance to explain to everybody what really is stem cell therapy, what it's doing, and all the science behind it. People are so curious. So I think a few more people have joined on now. Hi, Toronto, Pakistan. Oh my gosh, this is so cool. This is one of the best things about Instagram.
There's another one of these with the
you get to like talk to people who are not just in LA. So waving to you guys. Okay, cool. So Dr. Ross has been in private practice since like 1996. He's a two-time best-selling author. He runs this really cool, not runs, but he has an amazing podcast. It's called The Regenerative, which he's logging in from right now. He's an international speaker. He just has he's done all this research. He's done his fellowship a few years back, and he's already this like leading expert when it comes to stem cell and regenerative medicine. So Dr. Ross, let's just have people kind of get to know you and what your background is, and then we can dive into stem cells and then everything that we can do with it.
Love to. So should I just tell kind of how I got involved in this?
Yeah, okay. Absolutely. Tell everyone about who you are, what you do, and how you got involved in this. And meanwhile, I'm just going to wave and check in on people.
All right. You do the waving. I'll do the talking.
Yeah. Okay.
I like it. Well, actually, I am, as you said, I graduated as a chiropractor in 1996, but after a while, we integrated our practice. What that means is I started to join with other medical professionals. We had a medical doctor, physical therapist, massage. We had the whole gamut of all medical procedures. And the reason was, as a chiropractor originally, I was very limited in the way I could help people. We could only do adjustments. And that was very limiting. And I wanted to be able to help so many more people with all kind of different conditions. So when we integrated, it gave us the ability to all work together under one roof and really help a lot of conditions and a lot of people. So instead of just coming to us for a chiropractic care and then going down the street to get physical therapy and then going to their medical doctor for medications or other things, we just did it all in house. So we started doing all these wonderful procedures. And when that happened, we started doing a lot of joint conditions. We were doing knees and shoulders, and we were doing these these different types of injections, like lubricants. It's called hyaluronic acid. It's a lubricant, still popular, that is great for the knee, and it helps when you have knee pain. Yeah. Well, back in 2011, I decided, I was single at the time, so I decided to start playing dodgeball. Now, at 41, I'm 50 now. At 41, probably not the best sport to start playing. Because I was I felt like the chaperone, I was just suddenly like, I'm looking around. I thought this would be a great way to meet people. Of course, they were all 20 and I'm 40. So I was like, well,
I was like 8.
Exactly. Yeah. Your body can handle a little better. So anyway, I started playing, having a great time. And then one time I threw a ball and all of a sudden my knee collapsed. Now I'd never had an injury like that before. And I just wound up and I looked up and I'm like on the ground. Nobody had hit me and everybody's staring at me because nothing had happened except with me.
Wow.
And what had happened is I tore my ACL and I fractured my leg actually at the same time. It was crazy. So I go back into my office thinking, okay, I didn't know any of that at the time. I just knew I'd hurt myself. I'm thinking, well, I mean, we do rehab here at my office. I had 2 offices. And so I started doing rehab and it started getting better, but it didn't recover completely. It never felt normal again. And I was like, this is not okay. Something's got to happen. So I had a friend who was an orthopedist and I went to see him and he said, well, you're going to have surgery. That's the only option to fix this. And I know so many people that have had surgeries and they just don't ever recover. They just don't get, it's a perpetual cycle. They get in that surgery and then they always need revisions and then they need somebody to go and scope it. And I'm like, I don't want to be that guy because I'm trying to help prevent that. So I was pretty frustrated. And what happened was I was like, okay, I got to find a what connects the gap, right? Where you've got rehab and then you've got surgery. Right now, it's if you don't rehab doesn't do it, then it's surgery. I'm like, there has to be something between. So what I found out was I started doing some research online and I found a place in Thailand that was doing a procedure called stem cell therapy. Now, this is 2012.
I was just going to ask you what year it was. Okay.
2012. And no one had heard about stem cell. It wasn't even popular or something that people talked about. The only thing that you probably had heard about was negative. It was about like cloning animals and even, using killing embryos and just like horrible things. So I didn't know it was something that could be used for like normal people. So I decided, well, you know what? Instead of just reading about it, I want to see if this is legitimate. I need to know if this is real. So I took a flight. I spent 3 months in Thailand, in that part of South Asia, and I loved it there. And I went to the clinics and I learned all about this procedure they were doing, and it was using your own body's stem cells to stimulate or regenerate tissue in the joint.
Wow. Okay.
And so now I didn't do it there because when you are from, I was from Atlanta, beautiful city, high end city, most of it. And then I'm going to Bangkok, Thailand. If you've ever been there, sanitary conditions as well as other things are not where I feel comfortable. I don't feel comfortable doing a surgery like that, where they're drilling into my hip bone, taking out bone marrow and using those stem cells, which is the procedure. And I was like, you know what? Let's find something to do in the States. Now I know what to look for because I didn't know before. So when I came back, I really didn't find a whole lot of stuff. And then I heard about something by using placental tissue. Now I was like really skeptical of that. I'm like, wait a second. You're going to use some baby stuff I didn't like that idea at first. And I was like, so I had to get educated on it. And so the concept is this: when a woman is pregnant and has the placenta, that's basically the little factory, there are all these cells in there, regenerative type of cells that are creating that life and supporting it and protecting it. And so they take some of that tissue or those cells, and they can use that for other people. So when after the baby's born, there's this whole little this ton of regenerative cells that are usually just tossed out. Normally they're thrown away. But now we can recycle them and use them for other people that need something to be regenerated. And so that's the concept. So they use some regenerative cells from placental tissue. And I had my own nurse do it. And I was first one, and we injected it in my knee to see what would happen. Now, it wasn't like a miracle. It wasn't like that. What happened was, slowly over about a month, I just noticed that I became normal again. Because here's what was happening. I noticed when I got out of bed, I would favor my right leg. My left leg was the one that I injured. And I would kind of hobble around a little bit. But overall, it was fine. But if I did any lateral motions, I would be scared because I felt like I was going to collapse again. What happened over that month is I just noticed that I could stand normally, walk normally. All the recovery and my exercise started returning to its normal state.
Mm-hmm.
And I was like, I can't believe this. It worked.
Right.
And I got to the point where I was able to do exercise and run and not have that constant fear that I'm going to collapse,
Right.
which is which was a fear that I had all the time was I'm going to just fall over again like I did before.
Sure.
And so my knee just returned to normal. Now I had some MRIs that had shown that I had a fracture and I had a torn ACL. And like they said, there was no other way to fix this except for surgery.
Right.
And I'm 50 now. And you know how many knee surgeries I've had now? None. I've still had none. And I run and do more activities than I probably did back then. I'm running every day and my knee doesn't bother me. So
that's amazing.
Whatever it did in my body solved the problem. Right? It wasn't a degenerative problem, but it was a damage problem. So there was damage done, and it fixed the damage that was going on in my body, which was what I wanted. So I was so excited about that. And we had like I said, we had a physical rehab center, and I'm like, I'm going all in with stem cell. This is the most amazing thing. And we created the first clinic that I know of in Atlanta. This is 2012, called Stem Cell of Atlanta. Figure that was in the name. Why not? Yeah. And we created that office, and we opened 2. And we started seeing hundreds and thousands over time of patients with knees, shoulders, and hips. And we were helping a lot of people. So that's kind of how I got involved into the stem cell arena.
Amazing. So you guys who are just now joining us, just to recap real quick, this is Dr. Ross Carter, and he's just giving us some background about stem cell therapy and how he got into it, and all the amazing healing, regenerative possibilities that it has. And so just wanted to give you, so for those who joined on a little bit late, that's what we're talking about right now. And thank you guys for all the support. And I see so many familiar names and faces. I'm happy to see you here. So go ahead, Dr. S. Let's keep going with what stem cell therapy can do. He's obviously one of the leading experts with one of the first clinics ever. So let's go into more of what it can do. And, especially now with COVID, and you and I had a conversation about it a few months ago. Before I was even diagnosed and had it myself. Wish I had you around, but we're across the country from each other. But let's give people some basics on what stem cell can do for them and what the possibilities are right now with COVID-19.
I'd love to. Yeah, that's a great question. Mm-hmm. When I got involved in it and there was nobody else doing it, I said, I need a way to educate people. And I need to become the authority because as a chiropractor, people are like, first of all, they're like, wait a second, this is an advanced medical procedure. Why is a chiropractor involved in this from the beginning? And I totally got that, you don't go to your dentist to get, surgery on your stomach. Right. So it didn't make sense. So just so the listeners know, I did an extensive amount of education in this field because I wanted to be the best. There was not a lot of options at that time. Right. And what I did was I got a fellowship in stem cell from the American Academy of Anti-Aging Medicine. Right. When I did that, I was one of the first and I think only chiropractors in the world to get one of these type of degrees. So it took a year of time, a long time for me to study, but I'm studying just like all the other medical doctors that were in there. It was all medical doctors. Mm-hmm. So I got my education. So I decided to write a book. That's what I wrote, Doc Stem Cell.
Amazing.
Yeah. And it basically talks about the basics of stem cells. So let's go into some of that right now and talk about how it applies to anti-aging, inflammation, as well as COVID, because that is another area that most people have no idea that stem cells can actually have a benefit in.
Yes, absolutely.
So the basics of a stem cell is really this. We are all created from stem cells. A stem cell is an undifferentiated cell. Basically, it's a cell that can become any other type of cell. It can become a liver cell. It can become a kidney cell. It can be muscle, bone, ligament, skin. It becomes every part of your body. And when originally you have what's called embryonic stem cells, those are the ones that create your whole body, you as a being. But after you're born, you have what's called adult stem cells. Adult stem cells are not able to create another being. Okay, they're not able to create a whole new system, like a new, kidney, for example. What they can do is they create things like muscle, ligament, tissue, bone, blood. Those are what the adult stem cells can do. So what happens is your body is constantly in a state of repair. You've got cells dying like that. And then you've got new cells being replaced. Now, those cells come from a type of stem cell, right? For example, you have blood cells constantly being replaced. And then you have hematopoietic stem cells, which are creating new blood. So anyway, you have this constant cycle going on. Here's the challenge. As we get older, our cells those repair cells become a little lazier, and they're less. The amount of repair and damage that we have starts to go up, and our cells start to go down. So we get to that tipping point where our bodies just can't keep up with the demand. Also, the cells that are there. What's that?
So we need a little help,
We need a little stimulator. Now, you have stem cells are all out throughout your body right now. They reside on your blood vessels, mainly the mesenchymal stem cells, but they're called periocytes, and they just stick on the blood vessels and they wait for an injury. And when there's an injury that occurs, they kind of go into action and they turn into this amazing foreman, let's say a construction foreman, and they tell all the cells what to do. Okay, you do this, you do this. And they do this by this amazing mechanism of signaling. They send messages to the surrounding cells to do certain functions. And those signals are what we tend to call something called an exosome. An exosome is a signal from a cell to another cell. And all your cells are communicating all the time. Well, this network is called, it's not T-Mobile. It's called your exosome network. And those are the way they're communicating. So anyway, when you're doing a therapy with stem cells, basically you're introducing these regenerative cells that come in and look at what's going on in the damaged areas. They're attracted to inflammation and damage. They hone in on the area and they go, okay, here's what's going on. We need these cells here to start doing their job. Now, the stem cells we inject, we used to think that they would create this brand new cell structure and new tissue and all that. What we come to find out is it's your own body that's doing that. But these cells that we're injecting are stimulating that. It's like giving somebody really that has no energy and tired a cup of caffeinated a cappuccino or an espresso. Suddenly they wake up and they're like, okay, let's get to work. Well, that's kind of what we're doing with this therapy.
It's like waking up what's inside already,
Exactly. So that's what these regenerative procedures do. It wakes up your regenerative ability because it's not doing it right now for whatever reason. So that's one main thing is they're tissue regenerative in terms of they stimulate the body to start regenerating. The second thing is they modulate the immune system, which is a fancy way to say they control how your immune system's responding. Typically, when you get damage, what happens? You get swelling, you get inflammation. Well, these cells modulate that immune system, meaning they're going to decrease the inflammation. And so that allows those cells to start to regenerate because the inflammation is supposed to happen, but then it's supposed to decrease. And that's when the new cells are being produced and it's repairing itself. So stem cells have the ability to regenerate tissue or stimulate the repair of tissue. Plus, they modulate the immune system and allow it to take down inflammation. Now, most people don't know that inflammation is really the cause of pretty much everything. It's really the cause of why you're getting older. It's called inflammaging, actually. It's the reason that's my new book, actually. Inflammaging, right?
Good title.
It's talking really about how inflammation is really the root cause, or at least the accelerator of why we get older and we age.
Right.
Heart disease,
Mm-hmm.
inflammation.
Mm-hmm.
Cancer, inflammation. Stroke, inflammation. Obesity, inflammation.
Right.
Diabetes, you name it, it's most likely inflammatory in response. And we need to find ways to minimize the amount of inflammation in our body.
Right.
Nutrition is a big key. You have to have a strong foundation for your body.
Absolutely.
Here's the thing. So when a patient would come to me and they would say, "Hey, I want you to do an IV and just make me healthy and all me back to normal." I go, "Okay." And they're like, 80 pounds overweight. They're out smoking a cigarette. They're drinking all the time. They're not have a healthy diet. I have to say no, because if you don't have a strong foundation, I don't care what you're going to put in your body. It's not going to work.
Right.
You have to take responsibility for your health. Whoever is there has to be responsible. This is something that can help, but it's not the solution, the magic bullet to solve all your problems. It's just
there is no magic bullet, right? Like, I mean,
some people believe that.
Yeah,
They get this concept
exactly.
that
That's
this one thing is going to solve everything in your life, and it's not.
No,
it's not the way.
You can. You absolutely have the ability to
You do.
provide your different resources, to eat the right foods, to have the proper lifestyle, to go get therapy like stem cell therapy that if it's available to you. It's a combination of different things, right?
Right.
So I'm so glad that you pointed out that stem cell may not be like your magic pill, but it is something that can help you if you have a good foundation.
Right.
I love what you were telling people just about there's the regenerative side of stem cell, right? But also that it really helps with inflammation, because that is one of the primary issues with, say, COVID-19 and respiratory disease and inflammatory response inside. And so, I just read in mid-May, I think the 14th, the FDA had approved this like a half trial or a phase half.
They've got a bunch of trials now with using different components of stem cells to help with COVID-19. So let's go into how that works. Can I do that? All right. So COVID-19, what happens in the body that causes it to be so deadly is it causes an hyper inflammation, excessive inflammation that's not normal. Right. So it gets into your lung system and it causes inflammation, which causes fluid retention. When you get fluid in your lungs, it's called drowning if you get a lot, right? Yeah. But that's really what's happening. It prevents your air to get in and out of your lungs. And that's why you need a ventilator to help you breathe and stay alive. Right. So this hyperinflammation is excessive inflammation because your body's trying to protect itself, but it loses kind of control. So the concepts right now, there's at least 60 different trials using derivatives of stem cells or stem cells to help with this problem. Now, there's one using something called an NK cell. NK cell is your natural killer cells. It's really, if you look at your immune system, it has two phases. It has your initial phase and your secondary phase. Now, the initial phase is where your natural killers go in and attack whatever goes in. Right when it goes in the body, you got almost instant attacking. Right. Then you've got, I'm sorry?
Like soldier cells. I call them soldiers.
They are. But then, and so those soldiers go in and just kill everything they can. And then they call in the snipers. And those are like your antibodies, right? So those are your B cells. And that's your secondary immune system kicking in. And those B cells have a memory. They recognize different antigens from the past and they attack them. They know how to handle them, right? It's like if you're looking, if you like for what are those? Where you take they're trying to find an immunization. That's the concept of an immunization is you give your body a little piece of the antigen or a deadened version, and your B cells suddenly will figure out how to kill it, or if it's already dead, but they recognize it. And then if it comes back in your body again, they're able to say, hey, we know this, and we go after it. And that's the concept of immunization.
Right.
So you've got your different cells coming in, your natural killer cells and your B and T cells, and
Right.
they are all attacking this antigen. Now, what happens with COVID is you've got too much inflammation,
Mm-hmm.
and so that now what they're going to use, one thing they're using is called your natural killers. They're supplementing these killer cells. These are your initial defense. So if your body, as you get older, your killer cells go down. They're become more less. There's less ability.
Yes, they're
So
weaker.
if we supplement, we give you a second line of defense, basically.
Mm-hmm.
So right when you start to get sick, and your killers are out there trying to do their job, if they're overwhelmed, then you're in trouble. That's when the
Right.
problems start happening.
Right.
But so they thought, well, you know what? Why don't we just add these natural killers, which are you can use in anybody, and they inject them into the body, and it's basically your second wave of defense to try to kill this virus before it takes over your body. So
Mm-hmm.
that's one of the big studies that's going on from a company called Cellularity,
Right.
which is
Yes.
which is
Yeah. Semantics, yeah.
yeah, which is Tony Robbins is a fan of. He works with that company.
Absolutely. Yeah, great company. They're really on the forefront, right? Of
Yeah,
all these
they are. That's Bob
possibilities.
Harari's company.
Yes, no, that's so fantastic, and I love how you explained it. To really make it it's easier to grasp. Just even saying soldier cells and snipers, like, so that people have an idea of what is going on in their bodies when they're sick.
Right.
I think that when you can even visualize it that way, when you explain it that way, it's something that we can grasp and remember that this is what's going on inside of us, instead of thinking that we don't have any control, and this is
Right.
something that we
Right.
can't see and we don't know and we don't understand. So thank you for that. How else, let's talk about the different ways, you can receive stem cell therapy, and
Sure.
that kind of difference between stem cells and exosomes, because
Sure.
guys,
I'll get into that.
I was privileged enough to be able to get a treatment from Dr. Ross back in the fall, and that was amazing. And so I'd love for you to explain to someone, like if
Sure.
they come to you or someone else, how the process goes.
Sure. Love to. So to back up the other way that they're using research right now is with the stem cells is to decrease the inflammatory. That the inflammation we talked about, that's way too excessive.
Yeah.
They can use stem cells themselves to take down that inflammation.
Right.
So your response isn't as crazy.
Right.
So that's where stem cells can fit into helping people with their immune system, as well as help them recover from COVID. The other thing that it does is it's regenerative. Now, one of the things that a lot of people don't know is when they get COVID, some people, if it gets really bad, it starts damaging their lungs and their kidneys.
Yeah.
So if you have stem cells that you're taking in your body, that helps to prevent scar tissue, which is one of the damages. Right. So it's it helps to prevent scar tissue and helps to regenerate the tissue that's been damaged. Right. So regardless,
I need to see you soon. I need to
huh?
see you soon.
Yeah.
Just because of what we had too. So
yeah.
I need to see a pulmonologist actually in the next couple of weeks, just to double check everything. Even though
perfect.
Now, but
so the way you can do, let's say, like a wellness IV or treatment. Mm-hmm. Now, this can be kind of a touchy subject for some people, because using IVs of cells like that it can be frowned upon by, because it can cause other problems to occur. Some people have a reaction or rejection of cells, and that is something that you have to be careful of.
Is that or is that a rare thing that people have?
It's not a common thing, but it does happen. You always, when you're injecting live cells of anybody into somebody that's not from their own DNA, or from their family members or something, and you're using some stranger's cells, there is a chance that it could be rejected. Right. But you're not doing that much to where that usually people have this huge reaction. That's just not very common.
Okay.
It is a possibility, and you should always be careful when you're doing these things. Mm-hmm. So because of that fact, there needed to be a way to maybe do this regenerative procedure without using a live cell. It's called acellular therapy. So here's what they came up with. Okay, so how does a stem cell work? How does it tell the cells to start doing their thing. Well, like we said before, they send messages. The T-Mobile or the AT&T, right? They send messages to the surrounding cells. So, well, if it's just the messages that stimulate your own body to heal itself, what if we just use a concentration of just the messages and not the live cells, and we use that instead to see if that could stimulate the same response?
Okay.
And what's crazy is that seemed to be the way it works.
Right.
So instead of I'm sorry?
So it's a safer route, but
absolutely. Think about it. Now you're not injecting some foreign cell that your body is eventually going to recognize and say, hey, this is not ours. We need to kill it, right? But now you've got this little tiny message that's going in influencing your own cells to do something. So that's what exosome therapies is the goal. So, because here's the thing. You've got to, I got a little dry erase board. So you got a cell. This is my cell.
Hey, that's a cell, you guys.
That's a cell with a nucleus, right? So what it's going to do is it wants to talk to this cell over here. And so it sends these little tiny different little messages to the cell, and it influences its behavior. Okay? Those little tiny things are the exosomes. They're 1,000th the size of the actual cell.
Okay.
So
1,000.
It can,
is that what you said?
1,000.
Okay.
Yeah, so a cell is gigantic compared to this little tiny message that it's being sent. Okay. So what happens in these labs, they're taking these very strong mesenchymal stem cells from placental tissue. So they're brand new. They're very, very active. And they're stimulating them to release the little messages to stimulate it to take away inflammation and to regenerate tissue. Because that's what it's normally doing, right? When it's young, you're saying, grow, right?
Right.
Well, we're taking these messages and we're taking it and we're putting it in our bodies, whether it be like through an IV, through general, or through a joint. You can put it into a joint and it can send the messages to start the stimulation, just like a normal stem cell would do. So it's nicer because it doesn't involve a live cell, and the chances of any kind of reaction or rejection is just so minimal.
Right.
So that's why I think this industry, acellular therapies with either, and they're called different things. Some people call them exosomes. Some people call them, there's several different names, but the idea is an exosome. Right. And that's EXOSOMES. So if you want to look up what an exosome is, you can look it up. Now, every cell in your body produces exosomes. And when you look up exosomes, here's what's going to normally happen. You'll see it related to cancer. Right. Now, why is that? Well, because all your cells create these exosomes, and we can monitor your blood if you have cancer from the exosomes that's in your blood, and it can tell us what's going on with the cancer. So they're using that as a diagnostic tool as well as a therapeutic tool. Right. So it's really both. Right. So so you can, exosomes are just an amazing way to do these regenerative procedures without putting somebody's foreign cells that have to be killed by your body. Right. And that's the therapy that I got with Dr. Ross in the fall. And it was so simple, painless. I mean, it took took 30 minutes, maybe 35 minutes. Yeah, I mean, if you take your time, of course. It's just an IV that, it depends on how fast you do the IV. Sometimes you want to do it slow or fast, but 10 to 30 minutes is the normal. And the possibilities are really endless. Like I'll give you an example. If and when I ever get COVID, which who knows, I may not, I don't know. But I will be doing my exosomes to stimulate my immune system, get my body to regenerate itself as quick as possible. Definitely, no doubt. And if I were in Florida with you, I probably would have called you and said, "Come over. We both got COVID, but we did it, holistically." And I share that all the time with my audience, and I shared it with you, the different things that we did. But if we had stem cell therapy,
that would have been amazing, super quick. It
Yeah.
probably would have taken 8 weeks
Yeah.
to have it. I did have some questions which you've
I
already
got it.
answered, but like people want to know, are there any other ways to get it? I mean, to get the therapy other than through IV and through injections, which you sort of answered, but I wanted to be able to put that question out there very.
Is there another way to get
Yes.
stem cells
I wanna
without
know.
that?
Mhm.
Well, you think about it. It is a cell, so there has to be a way of entry into the body. Now,
Right.
sometimes you can do an inhaler.
Mhm.
You can do
Okay.
it through an
Cool.
inhaler, a nebulizer, for example. That's
Okay.
another way.
Mhm.
I don't know how the results are with using nebulizers, but some people that have COPD, that's one of the ways they use. They use a nebulizer with either a stem cell or exosomes,
Uh-huh.
and that can help with inflammation. So
Oh,
that's another a route of delivery. IVs and injections are going to be probably the most common.
right.
I've even seen them as a nasal spray. I don't know
Oh.
how well that's going to be, but
Mm. Yeah.
in theory, it should work.
Yeah, it was a good question that someone had asked in the comments
Sure.
from the post today, because they have, people have fears of needles or IVs, like they want to know how else they could maybe possibly get it. I didn't know that about the nebulizer. I actually used the nebulizer
Yeah.
Ross, during my recovery period, but
Yeah.
we were nebulizing like glutathione
Right.
and
Other.
NAC and magnesium and other things while we were during our COVID recovery. But it's interesting to know that you could possibly do that with a stem cell as well.
One thing I would do is to warn people that you don't just go out and call up your local stem cell doctor.
Oh, yeah.
And you got to be careful on who you see.
Yes.
Here's the thing: most doctors, even though they're trying to do the right thing, they don't. It's really difficult to test products and determine if it's real or not good, or
Right.
if it's going to cause any problems or anything like that. It's really, and they're going on the information usually from a sales rep.
Right.
And
Right.
a sales rep is really going, there's can be some ethical ones, but there's some that aren't. And they can mislead a doctor into believing this, whatever they're using can do this, it can do this and that. And they'll make promises that doctors will reiterate to the patients, which are not necessarily true. So you have to be very careful in who you see. And in the United States, right now in this country, the use of regular, like just stem cells, like an IV of just stem cells and nothing else, is you can't even do right now, because right now the cells that they get now are a mixture of all kind of cells, regenerative. Yeah, so you have to be very careful if you're doing a stem cell. If it's a stem cell procedure, they can't really just separate just the stem cells and use those or manipulate them. And what that means is you can take a stem cell, and grow it into a massive quantity. But unfortunately, because of the regulations by the FDA, we're not allowed to utilize that. So you have to go to another country like Panama or Mexico or other European countries that'll actually allow the use of a manipulated stem cell, which is available, but just not here. Exosomes are still something that can be done here. We'll have to see what happens with the FDA at the end of the year, because there's going to be some changes in regulations. I'm hoping that with this COVID thing, and there's so many of these FDA approved researches that are going on to help with people that have it, that the FDA is going to be a lot more lenient, or at least give some better guidelines on the routes that we can utilize stem cells to help people with COVID issues. Yeah, we don't want to. I'd hate for everybody to have to leave the country to get a procedure that could save their life. When we have the technology here, we have the ability and technology. We just got to make sure that it's something that is available to the general public. And nobody really knows that yet.
Yeah.
We're waiting for the FDA to make their decisions on that.
Right.
Now, there are studies out there that some people can get involved in if they want to look into that, but you need to be careful and don't just go look up, Dallas, Texas stem cell and go, oh my God, well, there you go. Look for the cheapest price. Be careful. Be real careful.
What are some guidelines that you have for someone that, I mean, I'm so grateful I have you as a resource.
Sure.
anything without running it by you. But let's say someone doesn't, they've jumped on here, or they are going to Google, they've heard what you said, and they want to see if it's an option for someone that they know. Like, what are some guidelines? Like, what can they do to try and find a good source? How can they vet a source? What would your recommendations be?
Okay. First of all, find out the doctor's training in this specific area.
Yeah.
What kind of training do they have? Did they get a weekend course, or
Right.
do they have like a year-long fellowship in this? So find out the training of the doctor. Also, if you're going to a doctor for a respiratory issue, make sure they're a respiratory doctor.
Yeah.
Okay. So for example, you want to make sure that the doctor is a specialist in the condition that you are looking to get help with. So be very careful on who you choose, right? So make sure that they know exactly what they're doing. Also, you need to, it's challenging, but you'll need to find out what company that they're using products from.
Yeah.
Because you need to look up the information about that company online. Find out who
they use. Information, you can get that information. That's what we do. I mean, you just keep asking. Sometimes the first person you talk to on the phone doesn't know. You just have to keep asking, because that's public information. They have to say where they're getting their products from and who's manufacturing it, right?
No, they don't, actually.
They don't.
No, a lot of doctors will not disclose that with you. They're like, that's proprietary information, or, so they want to prevent their competitors from stealing their ideas or products or whatever. So they don't have to tell you. But I find that if a doctor or a doctor's office is secretive, then I would steer clear of that, because if they're not open and honest with what they do and how they do it, I would be very hesitant to use them. It's like, hey, I want to do the
forthcoming with their
and keep in mind,
transparent as possible. Okay.
Because these are thousands of dollars procedures. I mean, these aren't cheap. So you want to make sure that they know what the heck they're doing and they're using a reputable company.
Right.
And that can be and there is no doubt it can be very challenging. Right. Also, if you're going to a doctor's office that is working on a condition for you, ask them, well, if this doesn't work, or what is my expected outcome? What do you think will happen? And if that doesn't happen, what do we do?
Right.
Because, you're going to, some just say, well, too bad, in a nice way. But, you need to know what happens if it doesn't work, and what happens if there's a problem. What do they do?
Right.
So you need to be very detailed in knowing all these things as much as you can before you ever consider doing a procedure like this. You don't want to just, throw caution to the wind, because a lot of and if you can't afford it, don't do it. I hate to say that, but if you're like investing your last dollar, this is not a procedure to experiment with. This should be, unfortunately, because of the price, if you can't afford it, this is not the procedure for you. Make sure this is something you can afford, because you don't want this to be a Hail Mary and then be disappointed. And then, so you got to be careful with that.
And as you said, it's a powerful resource, and it's something that can help in your cell regeneration. It can help if you do come down with the virus or other types of issues that can help, but it's not the only resource. So you can't afford to do this. That doesn't mean that it's hopeless. There's a lot of other things you can do, and to always remember that the foundation is you, right? The foundation is lifestyle,
health, nutrition, exercise,
body.
So many things you need to do. This should be just a kind of the icing on the top of your and that's a bad analogy when we're talking about health, but but you know what I'm saying. It should be kind of like the high end part of your whole health program, and not the only piece, because you don't just eat the icing. You need the whole thing, to get the best results. And that's what we try to do is make sure that you get what you're looking for, but don't be unrealistic about what you're looking for. If it took you 50 years to wear out your knee and you think one injection is going to fix it, you're in for a rude awakening. It's not the way it works. That's not how it works, you know?
There is no magic button. It's just like it's compounded in a positive way, all the things that you do to support your body.
Sure.
Do you think that over time stem cell therapy will become more affordable and more mainstream?
Absolutely. It has to. I mean, as more people find out and learn about it and want these things, then, it's supply demand, right? The more people that want it, the more it's going to lower the price because there's going to be a lot more competition. There's going to be a lot more labs making the products.
Right.
So, I think that's going to help. And eventually, if the government gets involved, it could possibly put it as an insurance-based procedure. Actually, what's interesting right now is the Medicare is covering some amniotic fluid injections.
Oh, is it?
Not now. Amniotic fluid is just there's no cells in it,
right?
But
right.
it is a regenerative style procedure, and some of those carriers are starting to cover it. But you have to jump through a lot of hoops before they do. I mean, you don't just say, hey, my knee hurts, I want amniotic fluid and have my insurance cover it. It doesn't work that way. You have to have done a bunch of things before they say, and you also have to make sure your doctor gets it approved.
Right.
And so it's a process. It is a process, but that's a start.
Yeah, it's a start. That's encouraging.
Yeah.
So, someone just asked, what types of growth factors are in the amniotic fluid? Great.
There's a ton.
Yeah.
You got all kind of growth factors. So, I can't just list them all. There's like probably about 1,000. So there's tons of different types of growth factors. They do so many different things. So there's no way to answer that besides saying there's a lot.
Right. Right. And it's beneficial and its benefits are
It is. It's not something you want to IV though. You
right.
do not want to IV that. This could be something for like say a joint, and it's very safe for that typically. Okay. I haven't heard a lot of problems with any amniotic fluid injections.
Great. Well, that leads us into a question that popped up, and you had already sort of addressed it in the beginning. It was just about side effects, and you had talked about side effects as that can always happen if you're injecting someone else's stem cells and less with the exosomes. But maybe if you could just go over that real quick for someone that had joined a little bit late. Any type of side effects that come from stem cell therapy and exosome therapy.
Over the years, we've done, I don't know, thousands of procedures. Fortunately, we haven't had the worst side effect that we saw was just it didn't work. Wow. But I talk to a lot of doctors. I do education and training for other doctors in the area. I do continuing education and stuff like that. And there are other doctors that have reported increase in swelling, some other issues. I've never heard of anything really so super serious, except that an exacerbation of the condition is usually what is the worst side effect that I've heard of. I haven't heard anybody going into anaphylactic shock and dying or anything like that. But I mean, there is a possibility that could happen, but I mean, we're talking such a remote possibility. So it's tough.
Well, I love that. I mean, this has been so informative. Thank you so much for spending the time. And we've just had so many people come on and tons of comments. It's been amazing. I know that you showed them your book. Maybe you can show them your book again.
Sure.
Because, this has a ton of information on stem cell research. I mean, it's kind of like all your knowledge about it, right?
You know what would be easier if they want to learn more of this book I did probably 5 years ago. It's not up to date.
Okay, so there's more now. We can
I'm doing a new one online and it's not ready yet.
Okay.
So
we'll stay tuned for it for sure.
Yeah, it's called Inflammaging, and it really talks about how cellular inflammation is causing us to age. Because right now we can do like aesthetic procedures on our skin to help rejuvenate our skin. We can use it for hair restoration. I mean, there's a lot of cosmetic things that you can use these type of procedures for, not just a joint problem or a generalized inflammation, but it's being used a lot in cosmetics now.
Right.
PRP is another one that's very, very popular. You might have heard of.
PRP.
Platelet-rich plasma, great
Right.
product. And if you don't know what that is, it's simply taking your blood, and it has two main layers and a middle layer that's your regenerative layer where it normally heals. And they take a concentration of that and they use it for various purposes to help with stimulation of regeneration. It's a lesser priced procedure in that realm of regeneration. So somewhere to start, it's a good place to start because it's coming from your own blood. Yes. No side effects typically from your own body. So that's usually a great area to start if you want to get into the realm, especially for joints and muscle issues. PRP is a good alternative and a good choice. So that would be one area I'd definitely look into. But if they want to find out more, they can just go to my website. Can I get that?
Yeah, yes, share with us your website and your YouTube and your podcast and just anywhere that people can find and connect with you. I'll definitely share all this as well, you guys. If you have questions, text me. My number is pinned on the bottom here, and I'll put this up as an IGTV as well. So can you?
It's just my name, Dr. Ross Carter.
Dr. Ross Carter. You will go to and see everything.
You can go there, and I do a lot of I do podcasts and shows. I have two. One's called Medical Influencers. The other one's Regenerative Warrior. Mm-hmm. And the Regenerative Warrior is primarily for medical professionals because it's really training doctors on understanding this whole field of regenerative medicine. Right. There's some great episodes. If you want to learn more, you want to get to the nitty gritty of learning about stem cells, exosomes, and other regenerative procedures, you can find some really amazing episodes. I mean, there's some really cool. And it's more for medical, but if you want to learn, I've got a lot of non-doctors on there that just listen.
On there, right? Wait, I've been on the medical influencer one, right?
No, you were on the Regenerative Warrior. I wanted to have doctors hear about success. Like, I'll give you an example. Like, I interviewed a guy that had stem cells because he had leukemia. And so what they do, which is very scary if you think about it, they irradiate your entire immune system. They kill off all your cells, all your blood cells, because leukemia is a cancer of the blood, basically. And then they inject these placental derived, usually, or somebody that's a close match. But in this case, in the cases I've seen, they're using just placental derived. They're injecting that to reboot your immune system. Now, if it works, you got a whole new immune system. Like your blood type can change from where it is to a different blood type. You can be a different person in essence. And it was how he was dying. And then he did this procedure and it saved his life. And there's some other friends of ours that have also been through this and have had success as well with leukemia as well. So this is the wave of the future. You've got it going after cancer. If you look up CAR T cells, for example, that's using your immune system cells to go and kill cancer. Mm-hmm. And they're using CAR T, and that's used in the hospitals right now. It's extremely expensive, but it's something that's actually currently available. I'm sorry?
I said, but it's available and it's an option,
Yeah, it can knock out cancer. So certain cancers, and they're expanding that to hopefully we'll get to the point where we can program cells using like a CRISPR type of stem cell combination where we find the cells, we can cut out the cancer and basically restore your body to a precancerous state. So that's in the future, I think.
Yes, that's the hope. And I think you're right. That's right there in front of us. And it's
cool. Yeah, it's just a matter of time as people develop it, and with all these laboratories working with COVID, it's just giving them the access and the resources to really ramp up all these procedures that we can do that they weren't doing before because of restrictions.
Absolutely. So that's actually one of the silver linings in all of this, right?
I hate to say it, but it is a positive. I don't hate to say that, but I with COVID, it gave people regenerative doctors that didn't really have the voice before. Now they can have a voice, and that's really important in this field.
No, absolutely. It's important for all of our futures, right? So it's important to always sort of find there are always positives, and as we've been taught and told, that with every challenge there is a gift. And so
Yes.
there's been a lot of challenges in this time, but there's also been a lot of gifts, and it's been a gift having you here today.
Thank you.
So, I know we're coming up to the hour. I just want to say thank you so much again. You guys, Dr. Ross Carter, he's brilliant. He's amazing. Go to his website, and that's
Please.
drrosscarter.com. Check out his podcast. He has so much information.
Yep.
You guys will
there's a link if you go down below the second place. There's a place where you can sign up, and what I'll do is I'll send you information, anything that you're looking for. If you have a question, for example, you can ask it there, and I'll be the one responding to you. So if you have a question, go there, type it in there, and I'll send you the answer.
Amazing. And then send me that link. Just DM me that link or text me that link, and I'll make sure it goes up into like the caption of your episode.
You could if you look on the tabs, there'll be one for the medical influencers and the regenerative warrior. Right now you want to look at the regenerative warrior. There's like 100 different episodes, and you can just look at the titles and you'll find one that will probably cover the topic that you're looking for. You're looking for, hey, can you use this in the spine? It's there. Can I use it in my knee? It's there. You want to hear celebrities talk about it? They're there too. So it's all there.
Amazing. It's all there. Okay, you guys, this was awesome. Ross, I love you. Love you, Elizabeth. Big hugs. I can't wait to see you guys soon. This was so informative and just amazing. And obviously, like, everyone's loved it. Just so many comments. And thank you guys all for joining me here today. There's the website again.
drrosscarter.com.
Yay! Thanks so much, you guys. Have a great rest of your day, and I'll see you guys soon.